Hope for reversing type 2 diabetes. Many experts believe type 2 diabetes is an incurable disease that gets worse with time. But new research raises the tantalizing possibility that drastic changes in diet may reverse the disease in some people. Recently, a small clinical trial in England studied the effects of a strict liquid diet on 30 people who had lived with type 2 diabetes for up to 23 years. Nearly half of those studied had a remission that lasted 6 months after the diet was over. While the study was small, the finding offers hope to millions who have been told they must live with the intractable disease. This is a radical change in our understanding of type 2 diabetes, said Dr. Roy Taylor, a professor at Newcastle University in England and the study's senior author. If we can get across the message that yes, this is a reversible disease, that you will have no more diabetes medications, no more sitting in doctors' rooms, no more excess health charges, that is enormously motivating. It is not the first time that people have reversed type 2 diabetes by losing a lot of weight shortly after a diagnosis. Studies have also shown that obese individuals who have bariatric surgery frequently see the condition vanish even before they lose very much weight. But the new study, published in Diabetes Care, proved the reversal after diet can persist for at least half a year as long as patients keep weight off, and can occur in people who have had the disease for many years. The researchers followed the participants after they had completed an 8-week low-calorie milkshake diet and returned to normal eating. 6 months later, those who had gone into remission immediately after the diet were still diabetes-free. Though most of those who reversed the disease had had it for less than 4 years, some had been diabetic for more than 8 years. When Alan Tutty, 57, learned 5 years ago that he had type 2 diabetes, he asked healthcare providers if there was a cure. It was a case of, "Look, you've got it, deal with it, there's no cure," said Mr. Tutty, who manages a home for people with brain injuries in Newcastle. Later, Mr. Tutty spotted a notice recruiting volunteers for a diabetes study that asked, "Would you like the opportunity to reverse your condition?" Mr. Tutty said he jumped at the chance, becoming one of 30 men and women ages 25 to 80 to sign up. Mr. Tutty was one of 13 participants whose fasting plasma glucose dropped, and during the 6-month follow-up remained below the 7 millimole per liter, or 126 milligrams per deciliter, that defines diabetes. Although Mr. Tutty completed the study nearly 3 years ago, his fasting blood sugars continue to range from 5.2 to 5.6 millimoles/L, he said. Type 2 diabetes develops when the body cannot use insulin properly or make enough insulin, so the body cannot properly use or store glucose, a form of sugar, and sugar backs up into the bloodstream, raising blood sugar levels. In the United States, some 8.9% of adults 20 and older have been found to have diabetes, and health officials estimate that another 3.5% have undiagnosed diabetes. Although no one knows exactly why the diet appeared to reverse diabetes, Dr. Taylor said the explanation may be related to how the body stores fat. Excess fat in the liver can spill into the pancreas, inhibiting insulin secretion and the liver's response to insulin, resulting in insulin resistance and diabetes. Going on a very low-calorie diet may allow the body to use up fat from the liver, causing fat levels to drop in the pancreas as well. That wakes up the insulin-producing cells in the pancreas, normalizing blood glucose levels.